Hello everyone. In this lesson, I will discuss about hepatitis D and E infection. To start from hepatitis D virus is the smallest known animal virus and it is considered defective because it cannot produce infection without concurrent hepatitis B virus infection. The 36 nanometer diameter virus is incapable of making its own coat protein and its outer coat is composed of excess hepatitis B surface antigen from hepatitis B virus. The inner core of the virus is a single-stranded circular RNA that expresses the hepatitis D virus antigen. When we see the epidemiology and the pathogenesis, hepatitis D virus can cause an infection at the same time as the initial hepatitis B virus infection, which is called co-infection, or hepatitis D virus can infect a person who is already infected with hepatitis B virus, which is called superinfection. Transmission usually occurs by intrafamilial or intimate contact in areas of high prevalence, which are primarily in developing countries. In areas of low prevalence, the parenteral route is far more common. The incubation period for hepatitis D virus superinfection is approximately 2 to 8 weeks. With co-infection, the incubation period is similar to that of hepatitis B virus infection. Liver pathology in hepatitis D virus associated hepatitis has no distinguishing features except that damage is usually severe. In contrast to hepatitis B virus, hepatitis D virus causes injury directly by cytopathic mechanisms, whereas hepatitis B virus causes damage to liver mainly by immune-mediated mechanism. The most severe case of hepatitis B virus infection appears to result from co-infections of hepatitis B virus and hepatitis D virus. When we see the clinical manifestation, the symptoms of hepatitis D are similar to, but usually more severe than those of other hepatotropic viruses. The clinical outcome for hepatitis D virus infection depends on the mechanism of infection. If it is co-infection, acute hepatitis, which is more severe than that of hepatitis B virus alone, is common, but the risk of developing chronic hepatitis is low. But if it is superinfection, acute illness is rare and chronic hepatitis is more common. When we see the diagnosis of hepatitis D virus infection, hepatitis D virus has not been isolated and no circulating antigen has been identified, and the diagnosis is made by detecting IgM antibody to hepatitis D virus. The antibodies to hepatitis D virus develop approximately 2 to 4 weeks after co-infection and approximately 10 weeks after superinfection. Regarding treatment and the prevention of hepatitis D virus, there are no specific hepatitis D virus targeted treatments to date, and the treatment is mostly based on controlling and treating hepatitis B virus infection, without which hepatitis D virus cannot induce hepatitis. There is no vaccine for hepatitis D currently, and because hepatitis D virus replication cannot occur without hepatitis B co-infection, immunization against hepatitis B virus also prevents hepatitis D virus infection. The second one is hepatitis E. Hepatitis E is the epidemic form of what was formerly called non-A/non-B hepatitis. Transmission is fecal-oral, often waterborne, and it is associated with shedding of 27 to 34 nanometer particles in the stool. The mean incubation period is approximately 40 days, with range of 50 to 60 days. When we see the pathogenesis and the clinical manifestation of hepatitis E virus, hepatitis E virus appears to act as a cytopathic virus, and the pathologic findings are similar to those of the other hepatitis virus. The clinical illness associated with hepatitis E virus infection is similar to that of hepatitis A virus, but it is often more severe. As with hepatitis A virus, chronic illness does not occur, but hepatitis E virus tends to affect older patients with a peak age between 50 to 34 years. Hepatitis E virus is a major pathogen in pregnant women, in whom it causes acute liver failure with a high fatality incidence. Hepatitis E virus could also lead to decompensation of pre-existing chronic liver disease. When we see the diagnosis and the prevention of hepatitis E virus, hepatitis E virus is diagnosed by doing antibodies to hepatitis E virus particles. IgM antibody to viral antigen becomes positive after approximately 1 week of illness, and the viral RNA can be detected in stool and the serum by PCR. A recombinant hepatitis E vaccine is highly effective in adults, but it is not used commonly in children. This is a summary of hepatitis D and E infection. Thank you for listening.